Welcome to the Dr. Janine Show. I'm so glad that you're here today. I'm Dr. Janine Bowering, naturopathic doctor, and today we're continuing our series on EMFs and how EMFs and EMR affect our health. Today I'll be talking a lot about what we can do, whether it's with our diet, with specific supplements and types of exercise that actually help to reduce that damage according to the exposure that we're getting from all of those EMFs, which are, again, electromagnetic fields and frequencies, and EMR, which is electromagnetic radiation that's in our environment. So we do need to protect ourselves. It has been definitely found and proven in the science that there are over now 1,200 studies that have correlated the effect of EMFs on our health, and of course not in a positive way. So this is something we really have to address. We don't often think about EMFs and how they're affecting our health because we simply don't see them. And depending on how sensitive your energy is, some people perceive the EMFs, and these people are called, very sensitive to electromagnetic frequency, and that's actually a condition that has now been coined in the mainstream literature in terms of medical diagnoses. Now, what do we do? And that's what today's episode is all about. So thanks for tuning in. I'm Dr. Janine, and be sure to like and give me that big thumbs up on our videos, as well as subscribe to this channel, and also be sure that you share the videos and turn on your notifications, because we always have new uploads here on YouTube, but also on social media, on Facebook, and it'll be on Instagram as well. So make sure that you subscribe and that you turn on those notifications so that you always get our newest videos that we're uploading and the content that we share, which is all, of course, about getting healthy and doing it naturally. So let's get a little bit into the physiology and how do EMR, so electromagnetic radiation, affect our bodies. And when we talk about the physiology and how this is actually happening, it's actually happening at the cellular level. And there's something called VGCC. So VGCCs are voltage-gated calcium channels. And what researchers have found is that the impact of the EMF, so the electromagnetism, whether it's from the radiation from our cell phones, but really to anything that's plugged in, if that's in our environment, then this can have this negative effect. And especially with the electromagnetic radiation, what's happening is that these VGCCs, it only takes about 5 seconds after that exposure of that EMF to open up these VGCCs and open up these calcium channels. And I'm going to draw this now so you can see exactly what I'm talking about to help to explain this. So when we have these voltage-gated calcium channels on the cells, so if this is our cell, what happens is that we have the channel here, and yes, calcium influx into cells at a certain degree is normal, but we don't want too much of it. And what happens now with that radiation coming from, let's say it's our cell phone, which is probably the most common radiation that we now have, comes and affects that VGCC. So the VGCC, the voltage-gated calcium channel, now allows for that massive influx of calcium into the cell, and that's not something that is a healthy thing. This can have a negative impact not only on the cell itself, so if this were our cell, but also on the mitochondria. And the mitochondria is now also getting too much calcium, and this can actually cause the mitochondria to burst. It has now implications in terms of our DNA health and the health of our DNA. And you can see now that that's definitely a correlation to developing cancer. Anything that's going to mess with our DNA and our cell structure is definitely a threat to our body and to our overall health. So we want to make sure that we are helping, and what can we do? And that's what today's episode is all about. How do we help to make sure that this is not happening? How, and what research has found, even what's interesting in terms of mainstream medicine, is that they found that when they were prescribing calcium channel blockers, so the drugs, again, not something that, is that I recommend because it's not natural, but in the event, and they were prescribing the calcium channel blockers, they found that it really mitigated and stopped the damaging effects of those EMFs on the cellular structure and on the body. So it's interesting, but we're going to talk about a natural way to do this in this episode. So how do EMR, or electromagnetic radiation, how do EMR affect our bodies? And this, again, how the VGCC, so all of that calcium that's flooding into the cell, has a negative impact on our muscles, as well as our heart. So when we think about our heart function, again, our heart, we know, is electrically based in the way that it functions. And when all of that calcium we have that influx of that calcium, it can really cause arrhythmias and mess up the pacemaker of the heart. As well as when we talk about fertility issues, so both in women but in men as well. So what's interesting is that the male genitalia have a ton of these VGCCs that I was talking about. So it's important to know that we have to protect the fertility as, of course, we develop and as we age, and that's really important. If you're trying to get pregnant and you've had difficulties, one of the things to do is to be very mindful, especially with the cell phone use, as to where you're holding the cell phone. And guys, I tell them all the time, do not hold your cell phone close to your genitals. The same is true for laptops. So if you use a laptop computer, especially if you're using it on the Wi-Fi and it's not wired in for your internet, if that's on your lap, that's not a good idea. Because why? Because it's going to open up those calcium channels, and there's that high concentration in the male genitalia organs, and it hit Faroon as well. I heard in one conference that it's basically like having an IUD. If you're using, so for women using the laptop on their laps, it's definitely having an impact on your fertility. So not a good idea. As well as in the eye. So when we think about the lens of the eye, and when we want to protect the lens, so the lens is, of course, what concentrates that light, and it allows for that light to come and concentrate at the back of the eye, so that now this nerve signal is transmitted to the brain, so the brain can figure out what we're looking at. So what researchers have found is that the EMF radiation actually has a negative impact, and especially the VGCCs. Again, too much calcium, and it actually forms a layer of clouding on the lens of the eye, and this is on the epithelial layer of the lens. And of course, that is your cataract formation. So that being, again, directly related to the EMF radiation. And when we think, again, going back to the cell phones, where is our cell phone? It's close to our head and close to the eyes, and definitely has that negative impact on our ability to see. So do whatever you can to not use your cell phone. And when you can, one of the tips in our first episode in part 1 of our EMFs that I discussed was some tips on what we can do with the cell phone. One of them is putting it on airplane mode to minimize that exposure. Never hold it up to and close to your body, and always keep it at a distance. If you need to use it to take a call, then you have it on speakerphone, and if you need to use wired headphones would be another tip. But check out the first episode on all the tips about how we minimize our exposure of our EMFs in the first place. As well as the nerves. So we have something on the nerves, and if you've heard me talk before, you know that I always talk about the myelin sheath, and the myelin sheath is an important aspect of how our nerves are protected, and it helps to make sure that that signal is where it should be. So the myelin sheath is made up of fats. So DHA, docosahexaenoic acid, that omega-3 fatty acid that's super important for our health, for our eyes, for our spinal cord, and our brain tissues. But the myelin sheath also depends on not only B12, which I talk a lot about, but DHA. And DHA is an important omega-3. It is basically the battery of our cells. I've been doing a lot of research on this lately, and the more I learn, the more I need to know. And the DHA is an essential. So we're going to talk about that when we talk about tips at the end of this video. But it's important to know that our nerves now definitely are related to, and the impact of those EMFs on our myelin sheath, and this is something that that's been studied. I'm going to share the study in just a second, but that we have to protect this myelin sheath. And number one, we have to decrease our exposure to those EMFs, but also we also have to make sure that we're protecting that myelin sheath, and doing it by, making sure that we have enough DHA in our daily diet. So one of the studies showed that definitely there is a correlation with the EMFs and the myelin sheath, which we'll take a look at here. And what they found was that the evidence from both in vivo and in vitro and epidemiological studies suggest that the association between the RF EMF exposure and either myelin deterioration or a direct impact on neuronal conduction, which of course could be part of the symptoms for people that are super sensitive to EMFs. So that correlation has been done. The EMFs definitely impact that myelin sheath, and then the nerves essentially can't fire because it's not allowing for the conduction of that nerve to be optimal because the myelin sheath. Now, myelin sheath disease is certainly, if it goes to the nth degree and it becomes very serious, then what happens is that's MS. So definitely preventable, but certainly if you have MS, you definitely want to protect yourself from EMFs. And the important information that I'm sharing today is even more important for you to be able to mitigate that risk that you may have. And may be one of the reasons why the MS developed in the first place. The brain as well. So when we think about brain health, certainly the EMF exposure, definite link, and studies have shown that glioma, which is a specific type of brain cancer, is related to EMFs, but also the effect of our neurotransmitters. So in terms of our melatonin and our serotonin levels, so sleep disorders definitely related to EMF exposure, anxiety as well, depression, even autism. So researchers have looked at autistic children and exposure to EMFs and Wi-Fi and all these things, which is really scary because if I think of my own children that are in school, and yes, that the Wi-Fi is definitely there, and it's something that is there a way, and that's the question that I asked, is there a way that as parents that we can help to protect our children? Yeah, they have to go to school and they are exposed to the Wi-Fi, but what can we do naturally and internally to give them in terms of diet and exercise? What can we do? And that's what I'll be sharing just a few moments to help our children as well to mitigate that risk of the EMF exposure. And also ADD, ADHD has been related. So we see, this huge influx in these, the diagnosis of autism, ADD, ADHD, and we have to ask ourselves, well, what's different? What has happened? Well, certainly Wi-Fi exposure is one of the things that I absolutely believe there's a definite correlation between what is going on with, unfortunately, that exposure to that electromagnetic radiation that's affecting our children every single day. And the other one is aging. So this is something that I've discussed for years when I talk about calcium and magnesium and in terms of supplementation. And we always want to make sure that we don't have too much calcium getting into the cell. Why? Because that causes aging to happen more quickly. Of course, we don't want that. And certainly when we take a look then again, when we were talking about the VGCCs that I discussed, that's something that, again, too much calcium because of that EMF exposure is flooding into the cells, which we can see here, and that causes cell rigidity, and that's not something that we want because we want to have the nice pliable cells in terms of our ability for our skin cells to look youthful, and too much of that calcium getting in is helping to get that aging process happening so much more quickly, which is, of course, is not something that we want. So we have a few people that are tuning in. I want to say hi to Nick. Hello, Nick X Gore. Hello, you're watching on YouTube. Nice to see you. And I know that, yeah, you're tuning in. I know you've got some concerns around 5G. So definitely that is a huge amount of exposure that we definitely have to do our best to help ourselves. And so stay tuned right until the end because I'm going to give all the tips of what we can do internally to help ourselves and to keep our antioxidant status up. And some of the things are a little bit shocking, probably that you've not heard before, so I'll be discussing that. We have Joyce Ann on Facebook. Hi, Joyce Ann. So great that you've tuned in. Thank you for watching. We always love your questions. So hello, Joyce Ann. And we also have, we have a question. about 5G. Okay, I'm going to come back to that from Nick in just a second when we talk a little bit more about the 5G and the radiation exposure. So how do EMR affect our bodies? Well, another impact that whether it is 5G and our cell phone usage or our Wi-Fi routers is the microbiome and leaky gut syndrome. So what they found is that the tight junctions, and when you've heard me speak about leaky gut before, the tight junctions are very important. We have to maintain those healthy tight junctions, which we see here. Now what happens in leaky gut is that there's damage to the tight junctions. They become very faulty, which we can see in this diagram. And now microorganisms and toxins that are not so healthy can actually flow into the cells, into the blood flow, and now the immune system reacts to that not in a good way, in a negative way, because now the immune system becomes hypersensitive, and what's happening is that it is overreacting, and that's the autoimmunity, and starts to attack our own cells. And so whether it's rheumatoid arthritis or diseases with the thyroid, so autoimmune thyroid disorders, this is all starting usually in the gut and what's happening there. So to know now that EMF radiation can weaken our tight junctions and can be related to leaky gut, that is another reason that I believe that, why is leaky gut on the rise and why is autoimmunity on the rise? Well, this is one of the reasons. People with allergies, that's usually autoimmunity first. And why does everybody have allergies now? Well, again, it has to do with the EMF exposure. So that's really important. So look back at our first episode on decreasing your risks and exposures from EMFs and how to do that. I shared a lot of tips in that first video. So make sure that you look at part 1 that we shot last week and we shared with you, as well as Candida. So Candida, again, is another organism that, we all have a little bit, and that's normal. But when it gets out of hand and it starts to really multiply, and this can cause symptoms of Candida such as craving for sugars, you could have a white coating on your tongue, you could have yeast infections and skin infections that are yeast related, dandruff, ear infections, sinus infections usually is related to Candida getting out of hand. And the EMFs affect Candida, make it much worse. So again, another reason why we have to really pay attention to our EMF exposure and use the tips that I'll be sharing today as to how to improve our antioxidant status. E. coli, so there's actually a study that showed that the EMFs actually make some of these negative organisms and bad bacteria more resistant to antibiotics. So when we take a look at this study that was done, the researchers found that the exposure to the RF and EMFs within a narrow level of irradiation in that exposure window made the microorganisms resistant to antibiotics, and that was specifically E. coli and another specific bacteria. So you can check out that study. And again, who knew, and why are we talking about this? Well, because it's so multifactorial, and what you're seeing with all this information that the EMFs definitely have so many negative impacts, and our gut flora, our microbiome is so essential to our overall health and keeping a healthy immune system, and the fact that it is sensitive electromagnetically and chemically. So our gut flora actually speak to one another, not just chemically, but also electromagnetically, and that's really important too, that we're keeping that balance. So now I'm going to talk about diet and EMF exposure and what can we do. So what are things that we can do to be able to help prevent that negative impact on our health from these EMFs? One of the things is high niacin foods. So, and I'll go through the list. We have both vegetarian and non-vegetarian options for the niacin foods, but niacin is a precursor to NAD. And NAD is definitely, and has been in the literature for about the past 10 years or so, because it's really important in terms of being preventative, in terms of the faster aging process. So when we're talking about longevity studies, it's all about NAD. And if you've done any kind of research on NAD, you know that yes, you can supplement with NAD. as a supplement, but also I always like to do things naturally and trying to increase our levels by doing it from whole food sources. So whether that's a whole food supplement or doing it in the diet and increasing our NAD food. So we'll take a look at them in just a second, but what the NAD does, so exercise is great to increase our NAD, but NAD is depleted by EMFs, and that exposure to the EMFs again depletes our NAD, then NAD can't recycle as well, and then we have a problem. So we definitely want to slow down the aging process, but we also, NAD is, in terms of being able to be very protective for our cellular health, is important as well. So some of the non-vegetarian sources of NAD include tuna. So tuna, if you love tuna, definitely be careful in terms of, your exposure to and the quality of tuna, but tuna contains NAD, as well as chicken breast and turkey as well. So chicken breast is great, and turkey is also another source of NAD. Pork is another source. So if you love pork, and pork also has other nutrients which are really helpful for maintaining our circadian rhythm, so that's important. Salmon is another source now, not only of the NAD, but salmon also has the DHA. So again, just watch for your sources of salmon. You want to make sure that it's either wild. Some people now are saying that farmed is better. I don't know. The debate and the jury's still out on that in terms of my perspective. Anybody who knows me, you know that I've always talked about not eating too much fish, and sometimes it's better to go with supplementation in terms of getting the DHA more specifically. And why is that? Because of the toxicity that is in the oceans, and we have to really be careful as to where we're sourcing our food from. As well as steak. So steak is another source of NAD, and anchovies. So typically a smaller fish is healthier because it hasn't had the same amount of, in terms of the toxin exposure, it hasn't accumulated that much, and there's less fat typically in anchovies because of the size of the fish. Now, some of the more vegetarian sources of NAD include nutritional yeast. So a lot of vegetarians use nutritional yeast in their recipes, as well as peanuts. So peanuts, I always prefer that, again, that they're organically sourced peanuts, because that's important for making sure that you don't have exposure to pesticides, and which is notorious with peanuts. Avocado as well contains NAD, and mushrooms. So whether it's maitake or portobello mushrooms, both types include the natural whole food sources of NAD. And again, NAD is again, the niacin foods are a precursor to NAD, and we want to increase our niacin foods as much as possible to be able to, not only help for longevity and having a long and healthy life, but also to make sure that we're decreasing that negative impact of the EMFs on our cells. Now, another thing you can do is fasting. So whether it's intermittent fasting or a prolonged fast, so whether that's 24, 48 hours, what the intermittent fasting is, it's helping to get us into autophagy. And autophagy is our body's cleanup mechanism. And that's something that we definitely want to engage in at least, a few times a week if you can do intermittent fasting. And that means choosing an eating window that is typically smaller than what you're used to. So that means, you could eat for 6 to 8 hours. Sometimes people like to do less. I'm comfortable with about 6 to 8 hours, and that's your eating window. So let's say you choose to eat, from in the morning, let's say, or you start at noon. So you start eating at noon, and then you can eat until 8 p.m., but then you don't eat anything. You can just have water, maybe some herbal tea, maybe some people say coffee. That's the way I like to do it with dirty fasting, is to get away with having a little bit of coffee to get me through. But that for that rest of that 24-hour period, you're not eating, and that's called intermittent fasting, and that can be really protective in terms of EMF exposure, because now it's turning on autophagy, which is our body's cleanup up mechanism. Now, there's something else that's fairly new in the research, and it's something called the NRF2 pathway. And what this is sort of one of the master switches to turn on our production of our own antioxidants, and whether it's supplemented by the diet, but also turning on this mechanism of the NRF2 pathway helps for our antioxidants to do what they need to do to protect us, of course, from free radicals. This pathway is also really important for decreasing overall inflammation in the body and increases our body's ability to detoxify. So our detox pathways are maximized with the NRF2 pathway, so that's important. And this is something that controls 3 to 5% of all our cellular protein in this pathway. So there are certain foods and things that we can do in the diet that help to increase this pathway, and that will have a positive benefit on our body's ability to fight off free radicals and specifically to fight off that EMF radiation. So one of them is green tea, and I love green tea, so whether it's supplemented or you drink 3 to 6 cups of green tea per day, and it's the VGCC, which is the important antioxidant which is concentrated in green tea and has a wonderful beneficial effect on our antioxidant status and being able to protect us from that EMF radiation. So increase the green tea in your diet. Sometimes it's included in supplements as well, which I love because it's important to get it again in that supplemented form. It's a little bit more concentrated. As well as, and you're going to love this one, red wine. So if you're a wine drinker, and again, everything in moderation, but a little bit of red wine or eating red grapes contain resveratrol. And this is something, another activator of the NRF2 pathway, which is great. And that's so important that we are able to, get enough of that. But of course, you can take it in a supplement form as well. When we talk about resveratrol, and that, of course, doesn't have the calories. So if you're watching your carbs, which is another factor in terms of protecting our cells, is not to go too high in the carbohydrates in the diet, because that will work against you in terms of your ability to fight off the EMF. So a lower carb or sensible carb diet, higher natural healthy fats is very important, and always remember that DHA, but we'll talk about that in a second when we come back to some of the supplements. And garlic. So garlic is another stimulator of the NRF2 pathway, which is a fantastic way, again, so use it in your cooking, eat, if you can, in your salads and things. Some raw garlic is always good as well to be able to have the allicin. So the allicin is one of the active components in garlic, which has, antibiotic properties as well, but it's a really healthy food to include to help to protect from the EMFs. As well as, now when we're talking about supplementation for EMF exposure, there are some very specific supplements. So when we were talking about the voltage-gated calcium channels, I was talking about calcium channel blockers, and that, what researchers and doctors have actually found was that when they put their patients on a calcium channel blocker, and again, being a pharmaceutical type, that it really decreased the negative impact of the exposure of the EMFs on their cells. So it was like kind of the light bulb went off. Well, what is our biggest natural calcium channel blocker? Magnesium. So magnesium helps to regulate the influx of calcium into our cells because they both compete at the receptor site. So here's the great thing, is that you can be supplementing, is something that I do every single day, is to take magnesium in, and I take the magnesium bisglycinate. And why is that? Because bound to glycine, glycine is an amino acid that helps with our collagen levels. So I love the beauty benefits of taking the magnesium in the glycine form, but also it is a fantastic way to make sure that we get that great absorption. So the bioavailability of the magnesium when it's bound to glycine is better than most of the other types of magnesium. So for links to supplements and things, check the description below, which we will share in the video, and you can learn about some of the supplements that I take specifically to help to protect against the EMF exposure. cellular. Another great one is turmeric, and the active component is curcumin. So curcumin we know has great immunity benefits and anti-inflammatory benefits, but it specifically activates the NRF2 pathway. So that's important for our antioxidant status and a really great way to make sure that we stay healthy and protect ourselves from the EMFs. Another great one is vitamin C. So vitamin C also activates the NRF2. And the thing with vitamin C is that you always want to get it from a whole food source. So you're looking for a whole food vitamin C. I can't stress this enough, because vitamin C, if you take it in the synthetic form and you take too much of it, actually becomes a pro-oxidant. So pro-oxidant meaning it's like a free radical. And this is where the danger lies in taking too many synthetic vitamins, especially when we're talking about antioxidants, is that you can actually be doing much more harm than good. So that's why the supplement that I take is a whole food vitamin C. And it's something that definitely you want to make sure that, you know, you're getting the right amount, just as Mother Nature intended. Mother Nature didn't put 2,000 milligrams of vitamin C in an orange. Mother Nature knows exactly how much we need to be able to offset some of those things that we're exposed to in a natural environment. Now, yes, we have to up our levels a little bit based on all of those extra EMFs that are coming our way. But again, doing it in a whole food source so that your body knows how to use those nutrients is really, really important. And, you know, it's something that I definitely recommend. Quercetin is another one. So quercetin has been in the news lately with its antiviral effects and to help from decreasing the stickiness of certain viruses, of course, that is all over the news these days. So quercetin is really interesting because it also activates the NRF2 pathway to be able for our antioxidants to really do a great job in our body to protect us, and not just from EMFs, but in terms of free radical damage in general. So quercetin is something that I absolutely love, and you know, it's important that we're getting those natural sources if you're going to take a supplement, that it is naturally derived quercetin. Another one, the big one, is DHA. So yes, we talked about fish and having fatty fish. You know, I used to say 2 to 3 times per week. I don't recommend that so much anymore, and the reason is because of the toxicity in the fish. But if you can get a good quality fish, absolutely. The easier way to go about it, in my opinion, is to take a high quality fish oil supplement. So when we take a look at these capsules here, you can see that this is the concentrated DHA, and DHA activates our NRF2 pathway, so of the antioxidant status. But DHA is actually the battery of our cells. So DHA in combination with water, this is what runs our body. This is what runs our cells. And if there's one supplement to take, it's DHA, to be able to allow for our own electrochemical process and magnetic process to happen in our body efficiently. When we're lacking in DHA, our batteries are dead and we get sick. So by supplementing with the DHA, what a great way to be able to keep our batteries healthy. And this is your energy, this is your eyes. So the highest concentration of DHA in your body is actually in your eyes. And it's at the back, at the macula of the eye, and there's a reason for that. And that's something that I'll speak more about in a future episode on circadian rhythms. And I'm doing a ton of research on that right now. I'm working on writing my third book, and so I'm really excited about that. But it's important to know that that DHA concentrates in the eye for a reason, and it has a lot to do with our circadian rhythms and how our brain is activated by the light of the sun. And that's how we're meant to be, you know, centered, and our circadian rhythm is centered on what happens in terms of light and dark, and being able to turn on and turn off certain brain chemicals is important when we're talking about our overall health. And when we talk about of course, I always talk about the microbiome. So probiotics is another supplement that helps with EMF exposure. And our microbiome is light sensitive, but it's also sensitive to EMFs. And we heard earlier when we talked about the study in which scientists have proven that radiation and radio frequency emitted by Wi-Fi routers has a negative impact on our gut ecology and actually makes some of the bad bacteria like E. coli more resistant to antibiotics. So there is a definite, cause and effect with EMFs when we talk about that exposure and what it does to our gut flora. And we know that our gut flora people say 80, 70%, I say 85% of our immunity comes from our gut and stems from the ecology in our gut. So it's important to be able to have a positive impact on our gut flora so that we are protecting ourselves and our immunity as time goes on. So how do we minimize our EMF exposure? Well, one of the things that I love and that I make sure that I practice a lot more as, so certainly myself as a child, I look at my own kids that are bare feet and they run around with bare feet all the time, is called grounding. Now, grounding means that we are resetting our electrical charge, because as humans, we are electrical beings and we are electrically charged. Just, if you have a smart device, you're able to scroll. Why? Because we're electrically charged and have that impact. So what grounding does is it helps to offset too many of the wrong charges in our body and helps for us to connect to the earth, which is typically more negatively charged. So we get those negative electrons, which are healing, balances off our positive charge. Usually more damaged tissue, inflamed tissue is more positively charged. So it helps for us to find that centering and that grounding. But electrically, it is affecting our electromagnetism in our body. That's so important, because when we're exposed to all these EMFs, that has a negative impact and offsets our electrical balance. So we've got to reset. So grounding, how do we do it? Well, you've got to get barefoot. Now, cotton socks, if you wear cotton socks, this will work as well, especially if your feet are a little bit sweaty. Because we know that liquid, that's why if you have an ultrasound done, they put the jelly on, because it amplifies the ability for that connection and the electromagnetism to happen. But with the grounding, that a bit of that moisture on our feet, and if there's a bit of moisture on the grass, is a great way to connect. And it's really interesting because one of the most important acupuncture points, so acupuncture again is based on the electromagnetism of what's flowing through our bodies through the different meridians from Chinese medicine. One of the most important points is on the bottom of our foot, and this is called kidney 1. It has a lot to do with our entire vital energy in our body. And so kidney 1 on the bottom of our foot attaches to the ground, and that helps to center our energy and offsets, any of those negative impacts from the EMF exposure. So doing this for about 20 minutes barefoot on moist grass, so first thing in the morning with some natural sun exposure, is definitely the best and most healthy thing that you can do for yourself. Most recently, a friend of the family had a terrible migraine headache, and this was my first recommendation, was go barefoot, get out at the park and go barefoot on the ground. You've got to reconnect your magnetism, and it helped her a lot. And another thing is, when we're talking about grounding, is to make sure that if you can't get outside, to do your best in the home. So if you've got concrete, if you've got, which will help you to ground, just don't wear rubber-soled shoes. And I was guilty of this until just recently. I was wearing my slippers in the house and they had a rubber sole. Well, I'm not grounded at all. And I looked at my kids, and my kids are always, running around barefoot and very grounded and have all of the energy in the world. So this was something that I thought, oh my goodness, that makes a lot of sense, that intuitively, kids are very intuitive, that they run around with bare feet. So yes, definitely, if you can, do barefoot, if you can do that safely in your home. It's getting colder here in Canada now, so it's going to be a bit more of a challenge. But if you've got the cotton socks, natural fibers, and that will help to ground you as well. I've heard that ceramic tiles, yes and no in terms of grounding. If they've got a certain, a shiny coating on them, it's not going to work as well. But, do your best to get, the best thing is to get outside in nature. Also, if you're on a beach, so if you have the ability to be in the sand by the ocean and you're lucky enough to be by a beach, what a great way to ground your energy down. And again, being barefoot is really important. So when I see, joggers and runners that are out on the beach with their running shoes, it's always better to be barefoot in terms of grounding, because certainly the rubber soles on the shoes is not the best thing. So get out there, get barefoot and ground your energy. It would help to minimize that EMF exposure and that negative impact on your health. Another thing is exercise. So exercise is super important in terms of helping with our ability to offset some of that EMF damage. And so any type of exercise is great. HIIT training is definitely fantastic. You want to increase your nitric oxide load. So that's something I'll be investigating, and I'm going to do some trials for myself on nitric oxide dumping and doing that type of exercise. So I'll report that, and we're going to feature that in a future episode. Also the blood flow restriction training. So BFR training is a great thing as well, which I love. I have my straps at home, and so basically you wear straps to somewhat restrict your blood flow. So whether that's the larger muscle groups at the top of your quads, you put 2 straps, and then just above your biceps, and you restrict that blood flow, not 100%, enough that you can still maneuver and work out, but that really has a great impact on the ability to train at a lower weight in terms of your training. So you don't have to lift as heavy, but you still have that benefit of increasing that oxygenation and the nitric oxide, which has a positive impact on that EMF exposure when it's properly balanced. So too much nitric oxide with the superoxide causes formation of peroxynitrite, which is not a healthy thing. That's not something that we want too much of, and that is only really increased with EMF exposure. So that's something that we definitely want to decrease that too much of that formation, but to do it again in natural ways. And with all the tips that I shared today and all the foods and things and increasing our niacin, this is all great ways to be able to increase our protection from the EMF exposure. So be sure, I hope that you've learned a thing or two in this episode. Give me a big thumbs up, and thank you for tuning in. So Nick, I know that you're asking about 5G, and yes, does the 5G affect our oxygenation? Yes, so oxygenation in our cells can definitely be related, and when we have less oxygen in our cells, what happens? Well, yeah, our cells don't work as they're supposed to, and the oxygenation to our brain is impacted and to our muscles. So we definitely want to watch our 5G exposure. It's not something that, unfortunately, in most parts of the world, 5G is everywhere now. So we have to use the tips, and minimize our exposure as much as we can. And, if you need to move, you need to move. Certainly the higher you are, so if you live in an apartment or a condo complex, the higher that you are off the ground, think of grounding, so you're not as grounded. But usually there's a lot of towers to be able for people to get enough cell phone signal at the higher elevations, that this is even more of an impact and can negatively be impacting you in terms of your EMF exposure. So get down, get grounded, live on, and living closer to sea level is also a more positive impact. So I'm not saying that everybody gets up and moves, but however you can minimize. And if you do live up, make sure you come down enough during the day to be able to ground yourself. And also get an EMF reader. So there's different ones available. This is a pretty simple one, but it will start to really give you an impact and an idea as to what your exposures are. In my own life, in my office, I had an exposure that I wasn't even, thinking of. Yeah, this is kind of, or microwaves and things, you think absolutely this is definitely related to my exposure. But, there was something else in my office that I talked about in our part 1, so you can check that out. But just having a simple, reader to be able to read your exposures in your environment and then do whatever you can to stay as far away or turn them off or get rid of things that you absolutely don't need in terms of that EMF exposure. So thanks for joining me today, and be sure that you turn on your notifications. So subscribe to this channel, but also turn on your notifications. So click the bell so that you always get our newest information. And we share a lot, of course, and we do things certainly naturally here at the Dr. Janine Show, based on my own research, but also based on, what the literature shows us and working with patients. Being a naturopathic doctor, I had the great opportunity for years to work with thousands and thousands of people and helping them to, get healthier, again, from the inside out, doing it naturally and getting at the root causes of why people, got sick in the first place. And this is, something that you may not realize, that EMF exposure could be a huge part of why you're not feeling well, or maybe you manifested a certain disease process. So it's important to decrease your risk and protect your cells. We talked about some foods to eat. We talked about some supplements to take specifically for helping to protect from that EMF exposure. And of course, to do it all within, your daily routine to be able to help yourself. So I thank you for joining me today. It was a great episode. Thank you for everyone who tuned in. I love your questions. I love interacting with you. If you do have further questions and comments, we're always checking them here at the Dr. Janine Show. Myself and my wonderful team, we're here to help you. So if you've got questions, or if you have a suggestion for a future episode, I would love to hear from you as well. We're very open-minded people, and our team here, we love to interact with you and really provide the information that you specifically are looking for. So thanks for joining me, and always be sure to take care of your good health and to do it naturally.